Hi, I'm Mia Geisinger, AAP President. Today marks the anniversary of the founding of the American Academy of Periodontology. 111 years ago today, Drs. Gillette Hayden and Grace Rogers Spalding founded the American Academy of Periodontology and Oral Prophylaxis. These two periodontal pioneers saw a need for dental healthcare professionals to come together to discuss important developments in science and patient care, all to advance the health of our patients and of our communities. Today's AAP builds upon the founding work of Drs. Hayden and Spalding and strives to promote and elevate the critical role of the periodontist in establishing oral and overall health. Our scientific journals, the Journal of Periodontology and Clinical Advances in Periodontics, highlight high-level scientific research that can help us best treat our patients. But reading the journal is not the only way to get a firsthand look at these scientific breakthroughs. If you don't already, follow our AAP journals on social media at AA Perio Journals. And if you've not already tuned in, check out the newest podcast episode of the AAP's official podcast, Probing Perio, where Drs. Flavia Piri and Pedro Trejo discuss using socket shield technique on Apple Podcasts or Spotify for an in-depth look at this innovative approach. You can also take advantage of AAP member benefits to build your practice. A new dental hygiene study club module, Peri-implant diseases, classification, and clinical tips is now available. Position yourself as the go-to perio expert in your community. AAP members get 12 months of free access with the coupon code DHEI-coupon. Sign up now at dentalhygiene.perio.org. This offer for 12 months free access ends on June 1st, so hurry. In the spirit of Drs. Hayden and Spalding bringing colleagues together, join thousands of your colleagues in coming together for the 111th AAP annual meeting in Toronto, Ontario, October 15th through the 18th. The AAP annual meeting is an opportunity to learn cutting-edge techniques and emerging science in periodontology and implant dentistry. There are 28 hours of CE credits available at the meeting, and topics range from a deep dive into the impact of common novel pharmaceuticals like weight loss injections on oral health, and is the cure worse than the cause, to unpacking indications for a microsurgical approach to periodontal regeneration and an interdisciplinary focus on periodontal, prosthetic, and orthodontic interactions. I hope to see you in Toronto for 4 days of learning, networking, and personal and professional growth. As periodontists and AAP members, we're also part of a global community of periodontal professionals providing care to our patients. I had the pleasure of attending EuroPerio meeting in Vienna, Austria, and representing the AAP with our colleagues from around the globe. We have also collaborated with dental colleagues throughout the United States to sign on to a letter with over 250 dental and public health organizations to reaffirm the safety and efficacy of community water fluoridation. One thing that Drs. Hayden and Spalding saw was that we as periodontists are stronger when we stand together and advocate for our patients and lift each other up so that we can elevate our skills and our patient care. 111 years later, we are still better when we can learn together and support one another. Thank you for your AAP membership and for all that you do for your patients and for our profession. Cheers to the next 111 years of the AAP.